Hi everyone, and welcome back. So in this video, we're here with our lovely assistant Rochelle, and what we're going to be discussing today is thoracic outlet syndrome. So thoracic outlet syndrome is an umbrella term for different structures in the neck and the upper back that can occlude and restrict neuro or vascular bundles down into the arm. So we have a couple of different assessments that we can use for this to determine which structures are potentially causing the problem, whether we're dealing with primarily vascular or neuro in relation to the symptoms that the patient experiences. So normally what the patient would express would be at night time, sleeping with their head tilted to the side or driving with the arm up to the top. They can experience either general numbness and pins and tingling into their hands, or it could be pins and needles and tingling into specific aspects of their arm or hand. Now, when I'm describing this in clinic to patients, generally I would say if the pins and needles are generally into the whole hand, we're mostly dealing with a vascular issue. If it is into a specific spot of the arm or the hand, it could be more likely indicating a neurological issue. So in a different video, we're going to discuss the brachial complex from C5 down to T1, what it feeds and how we test for it specifically. But in this video, we're just looking for the general issue that's going to be causing the restriction down into the arm. So we have two separate tests. Our first test we're going to do is called our Roux test for checking for vascular restriction into the arm. Now, if we get a pulse reduction or diminishing, which is the positive finding for the test, we can also say that that could also be affecting the neuro supply as well. So what I use is an SpO2 reader onto the index finger of the patient's hand, leave it on, and we use it through the test because sometimes the practitioner's palpation skills might not be there. We might not pick up the pulse as well, and we can watch for the diminishing on, or they hear for the diminishing on the pulse oximeter read as well. So our first test is our Roux test. So we place index and middle finger to try and get our first pulse reading. And what we do is we traction the arm up and back. And this is checking vascular supply. Sometimes the pulse can diminish here, which can indicate restriction between the subscap and the pec minor area, or the subclavian area underneath the shoulder or the collarbone. So from here, what we do is ask the patient to take a big deep breath, hold their breath and look away from us, and back and release. We can then ask the patient to take another big deep breath and look towards us, and release. Okay, that's our Roux test. We'll describe it later, what they both mean. And our Adson's test is an inferior traction back. And it's the same principle and procedure. Ask the patient to take a large breath, hold their breath, and look away, back to the middle. And they can repeat the test looking towards us. Large deep breath, and looking towards us, and release. Now, a positive finding with the patient looking the opposite direction generally indicates elevated first, second rib and or extracervical rib, which is also a possibility if not previously diagnosed. Looking towards would generally indicate more of a scalene syndrome, or the scalenes are too tight and they can compress the vascular or neuro supply, respectively, whether we do our Roux or Adson's test. It could be the musculature in the neck that's affecting. So usually if we have one, we generally have partially the other, so we can have a kind of a positive on both, but more one than the other. So I hope that helps in investigating thoracic outlet syndrome and the differentials between our neurovascular, so our vascular is high, neuro is low, extracervical rib, or first, second rib elevation, looking in the contralateral side, looking to the ipsilateral side of arm lift is indicating more scalenes responsible for the issue itself. If we lose it as the arm tractions up, we're looking more at the subscap and pec minor area. Also, the infra area underneath the collarbone could also be causing the issue. So that can indicate to what area the practitioner may need to treat if we're having these symptoms. This is also assuming that the practitioner has ruled out all other pathologies in relation to the symptomology. So I hope that clears things up. Thanks a million for watching, guys. If you like what you see, follow the like and subscribe button down in the corner, and thanks for watching.